Hello, my name is Raiden Henderson, and this is my persuasive speech over the use of psychedelic drugs for therapeutic purposes. Ayahuasca is a drug derived from a root that grows in Peru, used by ancient tribes to treat both mental and physical ailments. Psychedelic drugs such as this, and also DMT, LSD, mescaline, which grows in peyote cacti, and psilocybin mushrooms, also referred to as magic mushrooms, and also MDMA, that's also referred to as Molly, has been scientifically proven to treat mental illnesses such as schizophrenia, PTSD, OCD, anxiety, and depression. Today we will discuss the rise of mental illness in our country, the ineffective mainstream treatments for these mental illnesses, and the use of psychedelic substances for therapeutic purposes. Mental illness is on the rise in our country and is becoming more and more a problem as each day passes. 1 in 5 Americans suffer from mental illness. That's nearly 10 million Americans that face this on a daily basis. Not only this, but since 1938, cases of mental illnesses in the U.S. have doubled, showing that this is a growing problem that we need to face properly. Also, since Vietnam, cases of PTSD among veterans has increased 15%. And due to recent uses of social media, there's been a major spike in anxiety and depression among younger generations. Treatments of these mental illnesses have reported to be either ineffective or have adverse effects to the users. Many people suffering from mental illnesses that use these treatments and medications report that they either plainly do not work at all, or they suppress their actual personality and make them to the person that they not actually are. Another problem for many of these treatments is that they are very pricey. Most of these ranging from upwards of $10,000 a month for proper treatment. And any of those who cannot afford the proper treatment and go untreated not only propose a danger to themselves, but also society. Recent scientific studies have shown that the use of psychedelic substances for therapeutic purposes show promising results for the mentally ill. A recent study was conducted by the U.S. National Library of Medicine, where LSD was used to treat those with depression over a 12-week period. After these 12 weeks, nearly all participants reported having much lessened symptoms of their depression, and also no adverse effects to the LSD were reported. Another study was conducted by Johns Hopkins Medicine, where DMT was used to treat 362 adult males diagnosed with anxiety and depression. At the end of the study, 8 of those 362 males reported having little to no symptoms of their anxiety and depression, and again, no negative effects of the DMT were reported. Another reason that these treatments are very appealing is that they are much more cost effective, as these range from $30 to $60 per treatment, whereas the previously stated mainstream treatments range upward of $10,000 per month for treatments. As of now, these substances are labeled as criminal, but with some legislation, these can be changed where they can be used in a controlled therapeutic environment by a trained professional. Today we discussed the rise of mental illnesses in our country, the ineffective use of mainstream treatments, and the promising future of psychedelic drugs as treatment for these mental illnesses. This topic is very close to my heart, as I have a friend that suffers from mental illnesses such as depression and anxiety, and he was recently incarcerated for his use of psychedelic drugs for treatment. See, he suffered with these disorders for many years, and the only treatment that he found that worked for him was the use of LSD. However, since these are labeled as criminal substances, he was then caught and then sentenced to jail time. If these substances were put into the mainstream and used for treatment for many others, including my friend, he would be getting the help he needs instead of being in jail. Thank you.